Hey guys, welcome to A Sip of Aesthetics. I'm Dr. Adam. We have Annabelle with us today.
Hello.
And we're talking about some red flags versus green flags when you're going for a treatment, for an aesthetic treatments, and choosing providers and that kind of fun stuff today.
Yes. Let's see. Should we start with red flags or green flags?
I kind of like the red flags.
Okay, you're
stuff
toxic.
first,
We're going to
so
start with the red
let's go
flags.
there.
Let's do it. Okay, so these are some things that maybe we should be aware of when choosing aesthetic providers. And I consider these red flags. You can disagree with me if you want to.
Everything we're talking about here is opinion.
Opinion
of
based,
course.
okay? Not
And-
factual at all.
In this episode, at least.
Let's see.
But yeah, and I don't know if honestly, we'll see if
Okay.
we have the same opinion.
I have
if
a
we
little
differ.
list we can go through quickly
Let's
then.
go through it.
So I would say a red flag for me is a provider that says yes to everything you want to do.
I agree.
They never say no to you. They are just saying yes to any and everything, I think, because they want your money. But I mean, who am I to say?
I 100% agree. Now, I don't think you need to go to a provider who's gonna fight you on everything. Like, no.
No, not a fight.
And if you go and you want something simple and they agree with you, again, that's not what we're talking about here. But if you're, if everything is a yes without any kind of like back and forth conversation, I think that's what you mean. That can be a red flag. And I think because as specialists, it's kind of our job and our duty to clear things up and explain things that the client
sure.
comes in. So a lot of times clients come in and they have a good idea, but we're not magicians. There are certain things that we can do, certain things that we can't do, unfortunately.
We have limitations for
Exactly.
sure with treatments.
And we have to be honest with the clients, be like, okay, we can do this, we can make this area looks better. This is a little bit harder to treat.
Yes.
There's going to be a little bit more downtime, that kind of stuff. And again, I'm not thinking of anything specific, but we have to be honest with our clients
sure.
and tell them when.
Also, too, I think this is where we ran into this issue in this field where people had like filler blindness or were getting too filled and looking not human-like anymore. It's because providers weren't saying no. They were just saying yes and pumping it in there.
We have to give you some tough love sometimes. Be
Yes.
like, no, you're.
It's coming from a place of love. I want you to look your best.
Perfect.
Okay. Another red flag, in my opinion, opinion-based, once again. I feel like, well, actually, this is maybe not an opinion-based, but if you go to a med spa or a clinic, wherever, and it's your first time visit and they're not doing a medical clearance on you, for me, I feel like that's a little bit of a red flag.
Yeah. And the medical clearance, I think, just talking to, a physician or a nurse practitioner or a PA just to kind of make sure, going through your history, your medication. I think the biggest red flag, which unfortunately I've heard about, is people who go into a place for the first time and there's like no paperwork, nothing. They just kind of walk in and, I mean, maybe in different country, that's fine, but at least in the US.
It's crazy. Run
You're
away
supposed
if they
to
don't
fill
ask
some
you to fill
paperwork.
anything out.
Or
Yes.
at least online or on paper. And sometimes it can be annoying to, go through all the paperwork, but if there isn't any paperwork, I mean, I don't know how. I think from
Some
my understanding,
red
legally
flag.
speaking, you have to get the patient's name and birthday and some of that.
Basic
Some of
information.
that past history. So
Exactly. Well, anyways, that is why that's on my list. Let's see what else. Offers the hyaluron pen as a service on their menu. That's a red flag for me.
yeah, I agree with that. I think the hyaluron pen is a really bad treatment. So
Not the giggle.
sorry if you work for hyaluron pen, but I really think it's a bad treatment. I don't think
agree.
anybody should really offer it. It's it sounds,
It also sounds
like
really painful
theoretical.
too. Have
Yeah.
you like seen how, I don't know, it sounds very painful. It's like
Yeah,
a needle, it's the needleless lip filler essentially. And from what I understand when I read it, it's basically this pen that they just place over the lips and they force a bunch of pressure and hyaluronic acid into the lip tissue. And there's really no
Yeah, the problem is
precision.
Exactly. The problem is no precision. We've seen a lot of complications with it. And what we've seen with the bigger problem is we've seen a lot of people who think that they can do it without a license. You don't have to be, like
random
a
people in
nurse
their
or something.
garage are
Exactly.
just like offering
You're still
this
using
pen.
products that are FDA regulated, and typically speaking, you still have to follow the laws, the regulations, and um, I mean that honestly because I've seen people who think they're not doing it on purpose. That illegal stuff. Like I've seen people who don't have any like license in terms of nursing license or anything like that, and they're just calling like, oh, I just got that online.
They sell it on
Yeah,
I mean, I won't say where because I don't want you to buy it,
Yeah.
but they sell it at a lot of places that they shouldn't sell it at.
Yeah,
So
but
it's
like
easy to attain for
people
sure to
will
try.
also think that, oh, I just got that like license online to use the hyaluron pen. I'm gonna start injecting
Yes,
people. I'm
they
like,
take like the
no,
one
no,
day
no, no.
course
Yes,
is what you're saying.
you
Yes,
still
I've
need
seen
your
that.
license to use these fillers. Like if somebody told you that you can just get an online course, and again, these were people who didn't know that they're breaking the law by doing fillers
Yeah.
and stuff just because they took a 1 day course without any background licensing or anything like that. But no, these are controlled medications. The fillers, you have to have
A medical license.
a medical
And that was
license
one of my red
to do it.
flags, not going to at least a nurse practitioner, PA, or a doctor to get any of these aesthetic treatments. They need to be done by some sort of a medical professional, not
Exactly.
just any random person off the street.
100%.
Let's see. Should we just
Red flag number 5 or no more? No more red flags?
I mean, there's more red flags, but maybe we should switch it up and do a couple green
Okay.
flags.
Perfect. Green flags.
Okay, let's see. Green flags. For me, a green flag in a provider is someone that not only recommends injectable treatments, but is also recommending you do skin treatments to improve the quality of your skin. They're recommending skincare products. They're basically taking care of you from different, modalities and not just injectables.
I love
Well-rounded.
that. I love that. I think most of us, when we go, we wanna, look our best, and sometimes we tend to be focused on one thing. So somebody who at least is aware that of all the other treatments options that you said, even if they're not doing it then, and even if you say no,
Yeah.
I'm only interested in filler, but at least you want to know somebody
At
who's
least they're
aware that it's
offering
like
and
more
explaining.
stuff
For sure.
than just injections. For sure.
Let's see. What other green flag? A provider that gives you realistic expectations.
Yeah.
We're not promising, facelift type result from injectable treatments or laser treatments. I feel like realistic expectations is really important as a provider. And for me, it's a green flag.
Yeah, it has to do with what you said earlier. Sometimes, we want to go to somebody who's just going to tell us, yeah, everything's going to be great and
Yeah.
we can do anything that you want and it's, not going to cost you anything. But, so at the end of the day, you can go through that and, pay your money and do the treatments and you're going to be underwhelmed. So
Yeah,
I'd
then
rather
you're
somebody who's honest
unhappy,
from the
for
beginning.
sure.
One red flag that just reminded me of.
me.
I mean, if the prices are too good to be true.
It's because they are too
yeah.
good to be true.
We've seen some horrible stories, and again, not to go into deep, but yes, prices can vary a little bit from one place to another. But we've seen again
Not
people come in and
drastically.
it's like when something is like way too cheap.
We can give an
a
example.
lot of times
A syringe
something's
of
off.
filler should not be $200.
Yes, I agree with that.
That's
or
red
if you're doing
flag.
like I sometimes get these ads about like $4 a unit of like Botox or something. I would never
true.
go there personally because
Not
I know
seven.
something is off. That doesn't make any
Botox is not
sense.
$7 a unit. It is not $8. It is. If it's $9 a unit, I'm still side eyeing you, to be honest. But that's a whole different conversation.
Yeah. So if something is like really too cheap, that to me is red flag. I personally would not trust that place because unfortunately there are ways to make things look cheaper, but they're not honest practice. So
What's that phrase? You get what you pay for.
yeah,
Unfortunately, good
for
and
sure,
bad,
for
so.
sure. And there are some places that are more skilled and they'll charge a little bit more, which is completely understandable. But again, if it's something that's drastically different, drastically cheaper, I wouldn't go there. I wouldn't send any of my family members there, and I'd be very, very cautious.
100%.
Let's go back to green flags.
Another green flag for this is a pretty obvious one, but I'll say it nonetheless. I feel like a green flag is look at their Yelp reviews, look at their Google reviews. Reviews are so important. I feel like they tell you a lot, and you can tell, when you go on to someone's Google or Yelp reviews, if there's a significant amount of positive reviews, that's obviously a good sign. Yeah. Green flag for sure. But if you go and they have really interesting reviews, then obviously stay away. What is another green flag for you, Dr. Adam?
Um, putting me under the spot over here. I think somebody who just kind of like listens to you and is willing to have a conversation with you and kind of like is listening to, because everybody wants something a little different.
For sure.
So I don't like it when like when if you're gonna see a provider and the provider already has an idea and he's like, it's not like a cookie cutter approach where everybody's gonna do this, that. Somebody who listens to you, okay, I like my face a certain way, I like to look a certain way, and then they're gonna like personalize the treatment
For
based
you.
on what
It's
you
not
want and
one
what you
size
need.
fits all.
Exactly, because I've seen that
Yeah,
too, where
I agree.
people sometimes like somebody will like a provider will get like good at a specific injection or something, and then they just want to do it on everybody. And on some people it
Yeah.
looks great, on some people it looks okay, and on some people it
Looks
looks
maybe
really
terrible.
bad. Exactly.
Yeah,
So
everyone's face is so different and it calls for different things.
100%,
For
100%.
sure.
You can't just do cheek fillers on everybody. Some people really need it. Some people that's the last thing you want to
Yeah.
do. For instance,
Exactly.
I think kind of related to that, I've seen like, sometimes there's these like buzzwords, like,
For
oh,
sure.
facial balancing or something like that, which are great. They can be great, but I've seen it where somebody would learn, a specific approach, and then they just want to do it on everybody. So you come in
Yes.
for like lip
Everyone
fillers,
for
and
facial
they're like, nope, we
balancing.
gotta do, the facial balancing or whatever treatment it is. I'm just using that as an example. And
Sure.
again, facial balancing can be great for some people, especially if that's what they're looking for. And even if somebody comes in for lips, there's absolutely no problem with kind of also talking to them about like, facial balancing if that's what they
Yes.
need.
Mm-hmm.
But if you're like, no, 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 like, and you just kind of like, again, being overly pushy, as you were saying before,
Oh, yes.
just because.
Yeah, if a patient comes in for lip filler and it's their dream to get lip filler, I'm not gonna be like, we're not doing lip filler because that doesn't suit you. Instead we're gonna do 7 syringes in the jaw and the chin and you kind of have to listen to your patient too, because this
100%.
is a service that they're doing for fun too, as well as to make themselves feel better. And we have to keep that in mind too when we're
100%.
giving our suggestions, that it's their face.
100%. And that's kind of it all comes in together, because it also has to
Yeah.
do with, you have to listen to your patient, because everybody wants something different, and
For
we
sure.
are all beautiful in our own different way. And
Yes.
our job is to enhance certain things, but also always working with the patient. So honestly, the last thing I'd want to mention that's kind of like related, but also at least to me is a red flag. I mean, somebody who talks, and I see that a lot on social media, somebody who just talks like crap. I don't know if I can say this word over here.
It's your podcast, sir. You can say whatever you want.
Somebody who just talks like really bad about everything else, and they're the
And-
only one who knows how to do a
Or
procedure.
other providers.
Yes, I see that a lot on social media.
Me
where
too.
I think it's
So
people
bad.
are some doctors or some physicians are they just kind of
Competitive?
use that, and they're like, oh, I have that secret way to do the lips, and anything else is like really bad and horrible, and they're destroying your lips. You have to do it my way, otherwise no one
It's
else knows
wrong.
how to do lips.
Yes.
Yeah, exactly. Otherwise
Yes.
it's wrong.
Or,
I really
this is
don't
a
like
whole
that.
other thing. This
And
is
I think it's BS.
Now we're just going to a completely different thing. But I'm thinking also to like the surgeons lately saying that all, injectable treatments are so awful that no one should ever do them. It's going to ruin your surgical, procedures. Now we're just snowballing. But yes.
And I have a lot of surgeons friends, and I can assure you that's not the view that most surgeons have. That's not the view. But unfortunately, it's one of the things where kind of the loudest. It's just, even though there are few voices, but they're the
They're
loudest.
loud,
What is
yes.
that saying? The
think that
squeaky
is-
tires. The squeaky wheel gets the grease. Thanks for your help.
Oh, I've never heard that.
Especially
That's a man metaphor, because I would never know that.
But it's true on social media, because these things kind of like
They are
get you
so in your
angry and
face.
stuff. So like they get like the views and they get viral.
Yeah.
But I'm really not for that. I think there's a place
It's
for
called rage
everything.
bait.
Exactly.
Yeah.
So everybody's wrong. You shouldn't do anything. I really don't like these people. And unfortunately, there's more and more of these type of providers out there. So stay away from them.
Well,
Awesome.
anyways, those
Well-
were our green and red flags.
Yes, no, thank you for coming. I think that was a fun episode. Thank you guys for watching. Make sure you like and subscribe if you like this episode. Give us 5 stars.
And a thumbs up. Is there a
please.
thumbs up? Is that a thing?
Yes.
Okay, good.
If you guys have any other topics you want us to talk about, let us know, and we'll see you next week.